Good evening, guys. We've got discussion B on deck for now. Okay, the headline is how spinal cord injuries lead to chronic health problems. Now, this falls under healthy aging for me because sooner or later, the young people that have spinal injuries become elderly. So, we're going to twist it and see how it affects people's lives in long term. So here we go. Spinal cord injuries, SCI, are not just acute neurological events. They initiate a lifelong cascade of uh, psych, psychological, physiological, psychological, and social changes that dramatically increase the risk of chronic health conditions. The surrounding page content emphasizes that SCI should be viewed as a chronic condition requiring long-term multidisciplinary management rather than a one-time trauma. The biological chain reaction. SCI disrupts the central nervous system's ability to regulate movement, sensation, and automatic functions. This leads to motor and sensory loss, paralysis, or uh, paresis, reduces mobility, which accelerates muscle wasting, joint stiffness, and dependence on assistive devices. Automatic dysfunction, damage to damage to sympathetic and parasympathetic pathways, impairs blood pressure regulation, uh, thermo thermoregulation, and visceral. Let's see. Okay. Visceral organ control, increasing risk of cardiovascular disease, bowel and bladder dysfunction, and metabolic syndrome. Neurogenic bladder and bowel, incontinence, retention, and catheter use alleviate risks for urinary tract infections, kidney damage, and gastrointestinal complications, chronic inflammation, and metabolic shifts. SCI alters body composition, reducing lean mass and increasing fat while promoting systematic inflammation. Insulin resistance and dyslipidemia, pain and psychological stress, neurologic pain, spasticity, and depression compound physical limitations and reduce engagement in preventative health behaviors. Long-term health consequences. The page outlines a spectrum of chronic conditions that uh, disproportionately affect individuals with SCI. Cardiovascular disease, reduced mobility, and autonomic dysregulation contribute to hypertension, arteriosclerosis, and stroke. Metabolic disorder, obesity, insulin resistance, and type 2 diabetes are common due to sedentary lifestyle and altered metabolism. Respiratory issues, higher level injuries impair pulmonary function and increase susceptibility to pneumonia and other infections. Renal complications, chronic kidney disease often stems from recurrent urinary tract infections and poor bladder management. Musculoskeletal dysregulation, osteoporosis, fractures, and joint deterioration result from disuse and abnormal loading. Pressure ulcers, immobility, and sensory loss make skin breakdown a chronic wounds a persistent threat. Mental health changes, depression, anxiety, and social isolation are prevalent and often under-addressed. Risk modifiers and social detriments. Outcomes vary widely depending on injury level and completeness. Higher and complete injuries carry greater risk for autonomic and respiratory complications. Age and pre-existing conditions. Older individuals or those with prior health issues face accelerated decline. Access to care, early rehabilitation, and ongoing specialty care can mitigate many risks. Social support and environment, housing stability, caregiver availability, and access to adaptive equipment shape long-term health. Policy and equity factors. People with SCI who live in poverty, rural areas, or face systematic barriers often experience worse outcomes. Prevention and management strategies. The page advocates for proactive integrated approach, early rehabilitation, intensive inpatient rehab, focusing on give me 1 second, guys. Mobility, respiratory health, bladder bowel management, and skin care. Ongoing surveillance, regular screening for cardiovascular, renal, and bone health, plus infection monitoring, exercise and conditioning, tailored programs to improve fitness, reduce metabolic risk, and enhance quality of life. Multidisciplinary care, coordination among primary care, uh, psychiatry, urology, cardiology, mental health, and social services. Patient education, empowering individuals with SCI to manage catheter care, skin checks, medication adherence, and lifestyle changes. Policy reform, advocating for accessible housing, transportation, durable medical equipment, and community based rehabilitation. Broader implications. The page urges clinicians and policymakers to reframe FCI as a chronic condition requiring lifelong care. It calls for one second. Gotta get these apart. One second. Integrated care pathways that bridge hospital discharge to community living. Equity driven interventions to address discrepancies in access and outcomes. Public health strategies that include SCI populations and chronic disease prevention efforts. This holistic preventative perspective underscores the need for systematic change where SCI survivors are supported not just in recovery but in thriving across the lifespan. Let me know if you'd like this adapted into policy brief. Okay, guys, so that is it for tonight. I will see everybody tomorrow for shows. For now, Gator Wellness, take care, folks.